Psychology 200, MDD, Major Depression Disorder. Depression, created to aid in informing the general public of this disease. Symptoms. Although depression may occur only one time during your life, usually people have multiple episodes of depression. During these episodes, symptoms occur most of the day, nearly every day, and may include feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability, or frustration even over small matters, loss of interest or pleasure in most of all normal activities such as sex, hobbies, or sports, sleep disturbances, including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take an extra effort. Changes in appetite often reduce appetite and weight loss, but increase cravings for food and weight gain in some people. Anxiety, restlessness, slow thinking, speaking or body movements, feeling of worthlessness or guilt, fixation on past failures or blaming yourself for things that aren't your responsibility, trouble thinking, concentrating, making decisions and remembering things, frequent or recurring thoughts of death, suicidal thoughts, suicide attempts or suicide, unexplained physical problems such as back pain or headaches. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationships with others. Other people may feel generally miserable or unhappy without really knowing why. Treatment options. Antidepressants primarily work on brain chemicals called neurotransmitters, especially serotonin and norepinephrine. Other antidepressants work on neurotransmitter or dopamine. Psychotherapy. Two main types of psychotherapies: cognitive behavior therapy, CBT, and interpersonal therapy, IPT, are effective in treating depression. CBT helps promote people with depression restructure negative thought patterns. Doing so helps people interpret their environment with interactions with others in a positive and realistic way. Electroconvulsive therapy and other brain stimulation therapies for cases in which medication and psychotherapy does not help relieve a person's treatment-resistant depression. Woody Allen engaged in analysis for decades and once commented, "People used to say you're using psychoanalysis as a crutch, and all I would say, yes, you're hitting it exactly on the nose. I'm using it as a crutch." He used to say that psychotherapists helped him through difficult times in isolation. "It got me through periods of my life when I was unhappy and I was insecure. Just the act of having someone to speak to, someone interested in my problems in some way, was helpful to me." To help him manage his depression, Allen underwent psychoanalysis for a stretch of 30 years. Allen stopped and turned to clinical therapy for his depression, and following his sixth marriage to his wife, Soon-Yi Previn, he ended his depression treatment. Depression cited works. To the left, you will see the references I've cited for my research. My name is Monica Dent, and I want to thank you for joining me in Psychology 200, MDD, Major Depression Disorder.